Welcome to Nurses Note YouTube. Please subscribe our channel. Today topic is ECG waves and intervals. A typical ECG tracing of the cardiac cycle, heartbeat, consists of a P wave, a QRS complex, a T wave, and a U wave, which is normally invisible in 50% to 75% of ECG because it is hidden by the T wave and upcoming new P wave. RR interval. The interval between an R wave and the next R wave. Normal resting heart rate between 60 and 100 beat per minute. Duration 0.6 second to 1 to 2 second. P wave. During normal atrial depolarization, the main electrical vector is directed from the SA node towards the AV node and speeds from the right atrium to the left atrium. This turns into the P wave on the ECG. Duration 80 milliseconds. PR interval. The PR intervals is measured from the beginning of the P wave to the beginning of the QRS complex. The PR interval reflects the time the electrical impulse taken to travel from the sinus node through the AV node and entering the ventricles. The PR interval is, therefore, a good estimate of AV node function. 120 milliseconds to 200 milliseconds. PR segment. The PR segment connects the P wave and the QRS complex. The impulse vector is from the AV node to the bundle of His to the bundle branches and then to the Purkinje fibers. This electrical activity does not produce a contraction directly and is merely traveling down towards the ventricle, and this shows up flat on the ECG. The PR interval is more clinically relevant. Duration 50 milliseconds to 120 milliseconds. QRS complex. The QRS complex reflects the rapid depolarization of the right and left ventricles. The ventricles have a large muscle mass compared to the atria, so the QRS complex usually has a much larger amplitude than the P wave. Duration 80 milliseconds to 120 milliseconds. J point. The point at which the QRS complex finishes and the ST segments begins. It is used to measure the degree of ST elevation or depression present. ST segment. The ST segment connects the QRS complex and the T wave. The ST segment represents the period when the ventricles are depolarized. It is isoelectric. 80 milliseconds to 120 milliseconds. T wave. The T wave represents the repolarization, or recovery, of the ventricles. The interval from the beginning of the QRS complex to the apex of the T wave is referred to as the absolute refractory period. Duration 160 milliseconds. ST interval. The ST interval is measured from the J point to the end of the T wave. Duration 320 milliseconds. U wave. The U wave is hypothesized to be caused by the repolarization of the interventricular septum. It normally has a low amplitude, and even more often is completely absent. It always follows the T wave, and also follows the same direction in amplitude. If it is too prominent, suspect hypokalemia, hypercalcemia or hypothyroidism. J wave. The J wave, elevated J point or Osborn wave, appears as a late delta wave following the QRS or as a small secondary R wave. It is considered pathognomonic of hypothermia or hypercalcemia. Thanks for watching. Please subscribe our channel.